Welcome, everybody. Today we have a first part of our series about holistic approach to treating chronic diseases. Our guest is Dr. Preeti Agrawal. She's a specialist in integrative medicine.
Hello, everybody.
Dr. Preeti Agrawal is also a founder of Integrative Medical Center in Wrocław, Poland. She has 30 years of experience treating patients with different diseases. To start our conversation, I would like to ask you why holistic approach to treatment of chronic diseases is more effective in comparison to conventional medical approach.
So thank you, Yashoda, for the question. Yes, I know the conventional approach is basically more popular, and whenever somebody gets ill, you go and see a doctor who does a lot of tests and then ultimately writes you a prescription drug. So the approach of the conventional medicine is to basically treat the symptoms of the disease and to control the biochemical parameters which are out of range. According to the conventional system, eliminating this symptom and controlling the blood values is the treatment. It's according to the holistic and integrative approach, it's a bigger picture. Integrative approach is the approach which combines the medical system knowledge as well as the knowledge from other medical systems like Ayurveda, TCM, and besides that, it also takes into the account the psychological, the emotional, and other aspects of the patient's life. So, in contrast to the medical approach, in holistic approach, it's very, very important to get to know the patient. So, knowing the patients is the fundament of good treatment according to integrative medicine. Because according to integrative medicine, disease is a part of the person. So it has its roots in the person's life, in the history, in fact, in all aspects of life. So the goal of the integrative approach to treatment is to get to the causes of the disease. And the causes are highly individualized in each patient. So, for example, there are two people suffering with the same disease. It could be multiple sclerosis, it could be breast cancer. So the cause of these diseases are multifactorial. It's just not one cause. So getting to know the patient, we really find the multifactorial causes in that person. So once we get to know the person, once we get to know the causes, then of course we use the medical knowledge for doing all the testings and getting the whole biochemical picture as well. And then here we make a very complex and highly individualized treatment plan. So this is the secret of success in case of integrative holistic approach, because here we are just not addressing the symptoms. Of course, when the patient is in pain and the symptoms are very aggravated, the first thing any doctor and as well as integrative medical specialist does is to give a symptomatic relief. But we don't stop there. We get to the root cause of the multifactorial causes of the disease. And so the treatment plan is a long-term plan. And that's why it also gives long-term effects. So our goal is just not to eliminate the symptom. Our goal is to eliminate the causes so that the disease doesn't come back. And that is why it is so effective in the long run.
Well, you answered my second question, which I was going to ask you. Why do you believe in holistic approach?
I think your question is absolutely, it is appropriate. It's not my belief. It was like I was basically trained as a conventional medical doctor. And so I begin my career as a conventional doctor who worked in the hospital and who worked in conventional medical setups. But very, very soon, in the very beginning of my career, I found out that in spite of the best of my knowledge, because I was trained across the world in one of the best centers around the world, so in spite of my very good knowledge of the Western medicine, I saw that the patients keep coming back, and also saw that they have lots and lots of side effects in the long term if they need to use the pharmacotherapy. So that was the beginning point where I started looking into the patient and started learning other medical systems, especially the Eastern system, the Ayurveda, the TCM, and ultimately, of course, I did this specialty in integrative medicine. And my years of this knowledge, looking at the patient, basically, that's the reason why I changed, because then I could see that the effectiveness of the treatment protocols suggested according to this integrative approach was really very good. And most of these patients did not need to come back to me for prescriptions, because then by all those lifestyle changes, by looking into the cause of the disease, and mostly they were in the lifestyle they were providing, so we could, they learned. They could see the difference when they started correcting those lifestyle disorders and became more conscious. They just didn't have the symptoms coming back.
Well, it sounds fantastic. And I'm thinking, why do you think the holistic approach is not so popular then?
Mm-hmm. Yes, so this is a big problem, that it's not an easily available service. I do agree with that. So you can go to either a medical doctor, or you can go to a TCM specialist, or maybe an Ayurvedic consultant, or you can go for a psychotherapy, or you can go to a naturopath. So they are just spread around, and the patient needs to you can choose. But the thing is, it's not very popular in most of the countries. The integrative medicine started basically in Germany and in US. And basically, many universities in US have started doing this course for the doctors, where the doctors, besides who are well trained in conventional medicine, get familiar with and are introduced to all of those other medicines. So I think now it's getting more popular. But as far as in Poland is concerned, yes, I should say it's not yet easily available commodity. Because another thing is, it's just not gaining the knowledge by the doctor, but with the practice, the more patients you see, the more you treat and the more you observe. So the knowledge of the integrative medicine is basically coming from long time practice and long time observation of the patients, and there's so many aspects to it. And I have been working since almost 25 years with this approach, and really I could say almost 40,000 patients have gone through my clinic, and I think that has given me a lot of experience and a lot of confidence. And my deep down belief is that the body of every patient needs how to heal. our human bodies are constructed in such a way that the all that is needed is inside, is ingrained in our cells, and we really need to use this innate capability of healing, and that is the basis of integrative holistic approach.
So when we go to the regular doctor, we usually are going through some kind of tests, and then we have diagnosed with some disease, and then we get prescription, and then there are some protocols how to take these medical drugs. I understand that's how the official medicine works. And what is the difference between holistic protocols in treatment and the allopathic medicine, or let's say conventional medicine?
So in integrative medicine, we also do tests. Like I also go for the diagnosis of the physical symptoms, and so they are similar. But what is the basis of this is, as I told you earlier, that getting to know the patient. So there is a very deep and very long questionnaire, which has so many questions related to the lifestyle of the patients, about the eating habits, about the working habits, sleep and all, and emotional conditions, workplace, and the history, how the patient was born and what has been going on, how many accidents or how many treatments, and what are the predispositions. So everything is taken into account. So this is the big difference. So sometimes what happens in medical system is, like, a patient comes who is suffering a lot, has many symptoms, and for example, chronic fatigue syndrome, which is quite popular in Western cultures. And they do all the tests, blood tests, every possible, and they are screened with all the other diagnostic procedures. And sometimes it's that you don't find anything out of range, or you don't find any tumors, nothing is found. So then the conventional medical doctor is in a fix, because they don't know if nothing is out of order, what I need to treat. So here they are perplexed. But for us, as integrative medical specialists, this is not at all a problem, because we know that this chronic fatigue syndrome is a result of highly disturbed and out of balance autonomic nervous system, maybe for a very long time. In this history taking procedure and getting to know the patients, I know that I will find many factors which are out of place, and that is why the homeostatic system of the person's body is not able to take over. And from here, we will be using many Eastern medical procedures, and of course, also very good Western therapies are there, like auto hemotransfusions and intravenous vitamin therapies. So they are all very good part of this Western medicine, which give very quick results, and they can be used, because they're also another very important aspect of holistic integrative treatment is that it is very body friendly. So most of the approaches or procedures or techniques which are being used, they are basically not affecting the body adversely. So they are body friendly. They don't have any side effects. And they are very highly individualized and chosen in a very individualized manner. So it's just like you find out, you pinpoint where the problem is, and you just address it, and everything else gets completed up. And another very important part of a holistic integrative treatment plan is that with every meeting, the patient is getting educated. So it's like patient learns to take the responsibility of this condition, and education is in this way that he learns that the cause is within him or her. So if we know that the cause is there, So the cause can be also removed. So the patient, from the very beginning, he knows that he's not the victim of the disease, that he can overcome the disease, that if the lifestyle things and the way of thinking and many other factors are the cause, he knows that they cause by this help and by regular education and all that, they can be reduced. So that is why this integrative holistic approach is so effective.
Wonderful. But what kind of diseases can be treated by this integrative or holistic approach? And maybe also there is a difference between holistic and integrative. Do they mean the same?
Mm-hmm. So first, let me clear about holistic and integrative. So holistic approach means that you are looking at the whole picture. Whole picture means you are looking at the patient as a whole identity, that not only the body, but the mind, with the psyche, the emotions, the surroundings, the relationships, and you just pay attention to every approach of patient's life. So that is holistic. Holistic is not just natural. So this is one of the biggest, mistakes, that if somebody goes to a naturotherapist and he's using only the natural methods, giving herbs or maybe using bioresonance and all those therapies, so people think that is holistic. No, holistic means you're getting to know the patient on every level. And integrative means you are using the knowledge of the Western medicine alongside with the Eastern medicine, with the psychotherapy. So here you are using all kinds of techniques which can serve the patient. And so the integrative medical specialist will not be afraid of suggesting the operation when you see that is going to give the best results at this moment in patient's disease because it's advanced. And so here integrative medical specialists use whole gamma of therapies available, the Eastern, the Western, everything. And basically the integrative medical doctor is all the time educating himself. It's very open and very open to listening to the patient. The patient says, doctor, I found about this therapy and do you know anything about it? So as a integrative medical specialist, I would say, okay, this is very new and okay, I didn't know about it. Maybe I will read about it and we'll talk about it next time. So it's like you are open to everything all the time and just using the right technique and the right moment. So it's very important that even the doctor, integrative medical specialist, knows that sometimes very natural therapies used at the wrong moment, they can cause the same harm as using pharmacotherapy in high doses, which can have side effects. So the whole secret of good holistic treatment with an integrative approach is to find the best option therapy options at the present stage of the patient's condition or disease. And the next question you asked was about what kind of diseases we treat. Here, the thing is that we are treating the patient, not just the disease. So basically, integrative medical doctor can help with every kind of patients because the focus is on the person and not on the disease. Disease is part of the person. So once you know the whole person, then you know that some systems, the main systems, are out of order. So, and the disease is showing in this particular part because that may be the weakest part in that person. So this disease in some person will show up in some different place, but basically there's a whole systemic disorder which needs to be addressed. So what we are doing in holistic and integrative approach is that we are looking where the body cannot reset itself. Where is the hurdle? in this system. It's in the gastrointestinal, it's in emotional, it's in the autonomic nervous system, so we just find out which systems are not working and we start correcting with the system. So basically, I get to see all kind of patients, but mostly, of course, it's a very good approach for all cancer treatments. Depending on the stage, in the beginning stage, it gives marvelous effects. Of course, in advanced stage of cancer, then you really have to use the conventional medical procedures to get the disease under control. But even then, you can add all kinds of lifestyle changes to improve the quality of life. And then, of course, we treat all kinds of autoimmune disorders. They give very good effect in all kinds of chronic conditions. Yes, this holistic integrative approach is very successful, and I have treated all kinds of patients with Crohn's disease, with multiple sclerosis, with arthritis, and many chronic diseases.
So wonderful. It's amazing to hear all of that. But I would like to ask you, what is so unique in your clinic that people from all over the world want to travel and to get treatment with you in Integrative Medical Center in Wrocław?
Most of the patients say when they come here and have the experience of a clinic, they say, "Doctor, it's really a unique healing place." And I think everything about our clinic is really unique because I believe that to heal, we need a very supportive environment. So it's from the, from everything, the whole ambience, all the nurses and receptionists and therapists in the kitchen, and everybody is very well trained, and all of them basically believe in the inner healing capacity of the body, human body, and we all have regular meetings, and they are into it since such a long time, and basically they really believe in it because they have seen just amazing FX patients come with the with the statement that they are untreatable, and we are the last hope, and all our personnel is seeing, and so they are just they are getting more and more confident that it's happened. So the whole energy, the whole vibration of our center it's a highly vibrating place, I should say, and so I think, and people can feel it, and I think you do need high energies because when somebody is ill and low and cannot believe that things can happen. Our person also understands that when people are ill and they've been suffering and they've been looking for so long, so they can in the beginning be a little irritated and many other things, negative feelings they may have, but they have unconditional acceptance for who they are, and I think that's what is also has a very important part in healing.
You have also managed to gather all that advanced medical treatments in one place, and
Yes.
I think that may be also a reason that people want to come and have it all accessible in one place.
Yes, I think that is a very important part because over the years I've been working for so many years and I've traveled to so many integrative places and all that. So, and working so highly individualized way. So it's like choosing all the best pearls, which really work and which are very safe. So over the years, I've collected them together under one roof and if you learn how to combine and make use of them. So it's also very easy for the patient to get everything. Doesn't need to go here for psychotherapy and there for good food and detox to in some other place and maybe some other massage or acupuncture or any Ayurvedic treatments. So we have all those Eastern and psychological and good kitchen and besides that all those intravenous therapies, autoimmune, transfusion, and many all those natural therapies. So really, I think integrative approach is the future of very good medicine because it combines the best which the world has ever known since medicine started, and that's it. So for us, the patient is the center, is the focal point, and all those modalities are here ready to be served, just to choose which is going to work. So human being is such a unique being that it can't be any other way.
Thank you. We are coming to the end of that part of our series. Next time we will talk how to treat different diseases, particular diseases. So stay tuned with us, and I hope you enjoyed our podcast today, Dr. Preeti Agrava, and we will hear each other next time. Thank you.
Thank you.
Dr. Preeti.
Thank you, Machado.